Toronto is investigating its first suspected monkeypox case. The patient is a man in his 40s who was in contact with someone who traveled to Montreal. In that city, multiple cases have already been confirmed. More are being investigated. This clinic treated some of them.
Most of them, they present with flu-like symptoms. So sometimes it's a fatigue, sometimes fever, chills, muscle pain. The symptoms, they last for about 2, 3 days, 4 days, and then they go away. At the same time, they have eruptions that appear.
Montreal Public Health says most of the cases have been mild, and it's urging people not to panic, even though the situation is unusual.
It is an increase in the number of cases above what we are used to, since we're used to 0.
At least 15 countries have confirmed cases, with Israel and Switzerland among the latest. Dr. Vin says educating the public is key.
We can trace it back to certain types of either communal activities or a communal site. And so that's how we can do targeted education by saying that if you believe that you are in proximity or in direct contact with a confirmed or suspected case, or in this site or that location, then you need to monitor for A, B, and C. You need to inform your public health authority.
Earlier this week, Montreal Public Health said cases had so far been identified mainly among men aged 30 to 55 who have had sexual contact with other men. But everyone is susceptible. Monkeypox is not sexually transmitted. It can spread in a number of ways, including through open sores, close contact, and respiratory droplets. But advocates worry about stigmatizing the LGBTQ community.
It stops people from wanting to go get tested. It stops people from wanting to talk to the people who they might have exposed so they can get tested.
Montreal Public Health says there will be an update early next week. Valeria, Cori-Manocchio, CBC News, Montreal.